start us off, please, with your preamble and roll call, please.
Yeah, thanks very much, Chair. Firstly, I would just like to remind everyone that it's a public meeting and it's being recorded, and the recording will be placed on the websites of the Partnership and Dundee City Council for public viewing. I'll now take a roll call of the members, and if you confirm that you're present so I can record that in the minute. Okay, I'm aware that the convener is present. Councillor Lind, you're present?
Yes, thanks.
Okay, Trudy McClay.
Present.
Councillor Short.
Here.
Mary Wright.
Present.
Anne Buchanan.
Present.
Donald McPherson.
Present.
Diane McCulloch.
Present, Willie.
Vicky Irons.
Yes.
Thank you. Dave Berry.
Present, Willie.
Dr. David Wilson.
Yes, present.
Thank you. Sarah Dickey.
Present.
Dr. Cotton.
May I advise that Dr. Cotton's currently chairing a forum just now, so he may be joining later.
Raymond Marshall.
Present, Willie. Thank you.
Jim McFarlane.
My understanding is that Jim's currently off work at the moment, I think, Willie.
Okay. Okay, thanks very much. Will Park is absent. Eric Knox.
Present, Willie.
Thank you. Linda Gray.
Good morning, I'm present.
Okay, thank you. Martin Sloan.
Present.
And finally, Dr. Emma Fletcher.
Present, thank you.
Okay, thank you very much. The apologies have been covered. Item 2 is declarations of interest. It's for not any members of any declarations to the content of the agenda as it stands. Okay, there being no declarations, takes you on to item 3, and it's confirmation that Dr. David Wilson has been appointed by NHS Tayside Board to the vacancy on the IJB. Who's asked to note the position?
Can I just interject there, Willie? Welcome, Dr. Wilson. We've been trying to get a GP onto this this body for some time, so I'm really pleased that it's finally happened, and I'm really glad to see you here today, and we look forward to hearing your particular expertise on whatever issues are relevant.
Sure, yeah, thanks for welcoming me, Ken. Yeah, so yeah, keen to get involved. I've just moved up from Edinburgh actually about 6 months ago, but I'm a Dundee boy, so I'm pleased to be back up the road. So yeah, interested to hear what's going on and get a bit of a feel for things in Dundee.
Great stuff. Thanks very much. You can carry on, Willie.
Yeah, thanks very much, Chair. Item 4 then, before is a minute of the previous meeting, the Integration Joint Board held on 27th of October, which is submitted for approval. There's also the accompanying action tracker, which is for noting.
We have to approve these minutes, don't we? Do I have a second, or I'll move them if someone would like to second me? Lynn Short.
Dr. Fletcher wishes to make a comment.
Sorry, Emma.
Yeah, sorry, Chair. I just want to be clear in terms of one of the elements of the minutes, and that concerned the annual strategic risk report. It was noted at the time of the minute a particularly high and sustained risk around the DDAR service. And there was discussion, I raised concerns, I think colleagues on the IJB also did, around the subsequent reporting mechanisms and requesting a more kind of fuller report in terms of the position with regard to that. And I just want to make sure that that is captured for the minutes and an understanding as to what the next steps are with regards to that, please.
Okay, Willie, I think we can rely on you to capture that for the minutes.
Okay, thanks, Chair. Okay, you then have the action tracker before you have the minutes approved with a slight adjustment to it to reflect that matter is indicated by Dr. Fletcher. Got the action tracker then for noting.
Right. Yep. Duly noted. Donald's hands up.
I had a comment, Chair. It's something that didn't make it over, as far as I can see from the minutes to the action tracker, and I think it is quite an important point that we discussed relating to the carers strategy, and it was on page 8 of the minutes, where there was a direction to the chief officer, an instruction to the chief officer to bring back a delivery plan and performance framework for the implementation of the new carers strategy. And linked to that, I did raise a point that it was important that that performance framework be linked to the outcomes, the 4 outcomes that are set out in the strategy itself. And I couldn't see reference to either in the action tracker, and I do think that they should be there.
Yeah, I agree with you. Can we add that to the minute of the previous meeting on page 8, the relevant part of page 8, and ensure that that is included in the action tracker in future?
Right. Thank you, Chair.
Unless anyone's recollection is that's not what was said at the meeting, but no. So yeah, we can add that to page 8.
Okay, thanks, Chair. Takes you on to item 4, Performance and Audit Committee. The minute of the previous meeting is submitted for information, and you've also got the accompanying chairperson's assurance report.
Yep, was that that's duly noted.
Okay, thanks very much. Item 6 then, before you, the Chief Social Work Officer annual report.
Yeah, can I just say before we go on to the main part of the agenda, we have Emma Fletcher here. I know that Vicky also wants to update us on what the current situation is with regard to the Omicron variant. So Vicky, maybe you'd like to go first, and Emma, if you'd like to speak after Vicky, that'd be great. Thanks.
Yeah, so thank you, Chair. I really just want to take the opportunity at the outset of the meeting to offer an assurance to IJB members around the mobilisation plans that the Health and Social Care Partnership has initiated as a result of various pieces of guidance and announcements that were emerging towards the end of last week. And within that, I'll give you a very quick overview of the additional measures which we've taken across the partnership to ensure that we're as ready as we can be for the subsequent potential increases in demand. So the Dundee Health and Social Care Partnership Silver Command meeting, which already and has met consistently every week throughout the pandemic, reconvened for an extraordinary meeting on Tuesday morning, as I say, to review various pieces of guidance from Scottish Government, but also to understand if there was anything else we needed to mobilise across our service areas in advance of changes that we may witness across the system. So we've done a full assessment of our current plans, and we've taken additional actions which have reviewed the capacity that we've got across the system. It's fair to say that in connection with winter and festive plans, we were already developing contingency plans and additional capacity across the system to be able to cope with what we knew was going to be really quite a difficult period. So thankfully those plans are in place and we've got capacity across the system. We have, however, been notified that there are additional requirements across all of our teams in connection with regular testing. And we were also notified of various conditions in terms of self-isolation should any members of our team or any members of their family or household come into contact with a suspected or confirmed positive case of Omicron. So we've made sure that we've transferred all of that information out to all of our frontline teams, including those who are providing care through independent contractor providers. And we've made sure that they have all of that information available to them. The management team itself will obviously be meeting more regularly now, just to have a heads up in terms of capacity across the system as well. Social care workers across care homes and those providing care at home are now required to test daily using lateral flow tests, or at least test on the day that they're working prior to commencing their shifts. So we've also been working with colleagues across Dundee City Council to make sure that there are enough supplies of lateral flow tests made available and easily accessible for teams for them to do so. Quite clearly, and Emma's here obviously as well, we've had a lot of discussion with public health colleagues. There is going to be a significant push across the system to ensure that we have accessible options available to all of those who are eligible for the booster vaccination. And I was part of the vaccination programme board, which Emma chairs, which met yesterday. And I think we can certainly take quite a lot of assurance from that process and that meeting to understand that we've got, you know, quite good plans in place, and hopefully we'll be in a position to meet the level of demand which is coming our way. And Dundee, unlike many other areas, has for some time had quite a flexible arrangement for drop-in vaccinations as well. So we're hoping that people will make the most of the availability of that. Quite a lot of work has been undertaken, as I say, to assess capacity, but also to use the modelling work, which has been made available to us through Scottish Government Gold Command process. In particular, I guess the worrying elements of that are the potential impact that we might have on staff absence. At the moment, it's very, very difficult to predict what that will look like, but we've been given indication that we can expect that to be beyond anything that we've witnessed before. And that's where the risk comes for the IJB and the Health and Social Care Partnership, because I think as things stand, with the majority of the workforce being well or not having to isolate, I think we have good systems in place, good pathways in place, and good capacity in place across most of the system. But I have to make IJB members aware we are working to our absolute limits at present. So if you were then to take a chunk out of that capacity, you know, up to maybe 20%, potentially higher than that, we are really going to struggle to be able to redeploy staff into the right areas. So the options that we're looking at the moment, and this is not in total isolation, we are considering this with the rest of the system through the various different Gold Command processes, is essentially what we can temporarily step down in terms of activity in service areas. I have to say, when we've reviewed all service areas across the partnership, there are very, very few areas which don't count as being non-essential or non-urgent. So there's very limited capacity that we could redeploy there. But we're also going through the rest of the business to make sure that we can reduce unnecessary activity, including meetings. So I'm conscious we're in an IJB meeting just now, but we are looking at stepping down any meetings which aren't entirely essential so that management capacity can be redeployed in terms of the resilience effort. And I know that, Ken, you mentioned it at the outset, but where possible, where we have committees which are standing committees and do need to proceed, you know, for good reason, we're trying to conclude business as swiftly as possible so that others can get away to oversee more operational issues. So I think that's probably all I would say for now. We're getting quite a lot of inquiries through from a number of people who are just, I think, anxious more than anything else, particularly when they see the media coverage and the severity of the messages coming through from government. But I would really just want to offer IJB members some assurance that we know this, you know, we know our jobs, and we're doing all that we can to make sure that we have the right level of support in the right place so that people can access it whenever they need it.
Yeah, certainly that's my concern, Vicky, in terms of assessing capacity and making contingency plans. There's such an unknown, and I do hope that 20%, which is the figure that you mentioned, is the worst case scenario. I hope it wouldn't be any higher than that. Thanks for that update. Now, there are a number of hands up, but given that Emma has to leave at 10:45, can I bring you in, Emma, given that you're kind of talking around the same subject before I bring in any questions?
Thanks, Ken. I'll just give a bit of the data around it. So yesterday across Scotland, 4,002 cases were reported of COVID. And bearing in mind, about a month ago, we were being pretty static between 2,000 and 3,000. Our cumulative incidence that is reported over a 7-day period is currently across Scotland 463 per 100,000. That's the latest confirmed, and there is a bit of a lag in the data. So in the next couple of days. I do anticipate that increasing, but that is up from 366 the week before. In Tayside overall, the current 7-day cumulative incidence is 323, and again is showing one of an increasing picture. We're a couple of days behind Scotland's trajectory. Other places in Scotland started increasing before we did. In Dundee, the 7-day cumulative incidence is the lowest of the 3 local authorities and is currently at 270. I noticed it was actually one of the lowest local authority areas across Scotland at the weekend, so really quite remarkable. But again, unfortunately, that is showing an increasing trend, having been at 217 per 100,000 the week previously. We are seeing an increasing in number of Omicron cases across Scotland. And that continues to be very closely monitored. The data that was published yesterday showed 5 of the 296 confirmed Omicron cases across Scotland are in Tayside. But again, that doesn't include the likely and possible Omicron cases, which if you read the Omicron in Scotland evidence paper that was recently published, does show that the proportion of cases is higher than purely the confirmed cases that we are identifying. In terms of the Vax and Booster programme, the portal for 18 to 29-year-olds to book their vaccine is going live today, and we're in the process of operationalising the transition from the 15-minute to 5-minute wait, as announced yesterday. In terms of vaccination uptake, the Scottish average for over 18 is 49.5%, and for Tayside as a whole is 55.3% for over 18s. And to reflect that for people who are over 50, NHS Tayside uptake is currently 85.0% and is the second highest mainland health board in terms of delivery to people who are over 50. As we've heard, there's been a 5th acceleration of the delivery of this element of this booster programme, and the teams have been working really hard. We have assurances that the capacity as stands currently can accommodate the further acceleration of the booster programme, and through a huge collective effort, both within the organisation and across with partner agencies, we can confirm that we are well positioned in terms of the workforce. Also, I do want to recognise the huge efforts of everyone in delivering this booster programme, and particularly the workforce, everyone involved in delivering it. It is truly exceptional, their efforts, and we're very grateful to them. And also just our huge thanks to the public who are continuing to get jagged, because it is so critical going forward to make sure that we minimise the impact of this wherever possible. But the trajectory, the projections are of significant case numbers of Omicron in the future weeks.
Oops, it's still the Delta variant, which is predominant at the moment. Did you say that?
Delta variant is predominant, but Omicron is rapidly accelerating and displacing Delta.
Thanks for that. So I'll bring in those who had their hands up, and I noticed they must have updated teams because it gives you the order of where people put their hands up. Trudy, you were first.
Yeah, I just wanted to say both to Emma and Vicky. Vicky, you and I have spoken about staff absence previously this week and last week, and our concerns that not all staff absence is related to COVID. And we were wondering whether it's actually related to absolute exhaustion. And my plea to both you and Emma, Vicky, is that you maybe get something out to staff to really stress how important it is to take a break during their working day. I think that's extremely important, and I think a lot of staff are probably just working right through, but it's so important to try and keep them healthy.
Yeah, absolutely. Thanks for that, Trudy. Next up is Bailey Wright.
Thanks, Chair. I have 2 quick questions. One, I want to thank you, Vicky, for putting my mind at rest as far as the tests were concerned, because I had requested some test kits, and I'd got the message back to say that there wasn't any, and it led me to believe that we'd run out. But Vicky had the answer to that. It was the post office couldn't deliver them. So I'm grateful for that, because I was blaming somebody else for that. My other question is, why are the Dundee vaccination stats, the uptake figures, so low compared with the rest of Tayside and Fife? Is there a specific reason for that? I mean, we moved from the cared hall into a shop facility. Is that the problem, or is it staffing again?
So in terms of booking and availability, we have exactly the same proportionately for the population across Tayside. We know that the uptake rate in Dundee has always, within each delivery element of the programme, has been slightly lower compared to Perth and Kinross and Angus, and there are various factors at play with regards to that. We continue to review and monitor the delivery of the programme, and we will be delivering pop-up and community clinics as soon as we're through this further acceleration. So in the new year, they will be further spread out into the community to ensure everyone has the opportunity that is as easily accessible as possible to deliver it. But it's such a balance between pace and volume of delivery and making sure that we do go out and do those satellite pop-ups as well. So they will be coming.
Yeah, thanks very much.
And Councillor Short, please.
Thank you, Chair. I've had my booster. Thank you very much to everybody who helped with that. I didn't realise you could make soldiers blush, but there you go. There's a first for everything. I'd just like to say that with another hat on, I found that on Saturday, obviously there was a situation in the city centre, and that the staff had worked very closely with Police Scotland, and as far as I'm aware, it went off without any hitch. But I know that there were specific things were done to make it much easier. So I'd like to thank everybody for that cooperation and coordination. My other question is regards to those who are housebound. How are you doing with the housebound vaccinations? I've had various constituents contact me. They were in a bit of a panic because they were having to go to other places, and arranged through Vicky's team to get someone to come to them. And it's just, where do we sit with regards to the housebound getting their vaccinations, and do they do the flu and the COVID at the same time when they're doing it, please?
Thank you. So the housebound vaccinations has been particularly challenging this year compared to the previous year. There have been areas where the list size has more than doubled compared to last year, and the lists have required further refinement. And also because up until yesterday there had been a 15-minute wait, and that vaccinators were required to make sure that when they were vaccinating in the home that people were observed for that period, then it has created challenges. In addition, each acceleration of the volume of the vaccination programme draws additional resource. In terms of where we're at, the list that we have currently, everyone will be vaccinated by the end of this week. However, we do continuously get more people added to those lists, so it is a bit of an iterative process. But the teams are very alert. It is an absolute priority for us to ensure that that is completed, and we will take the learning from this year as well into next year's for the housebound delivery.
Okay, thank you so much. I appreciate your answer. Thank you.
Donald's next, please.
Thanks, Chair. I mean, briefly, I did just want to acknowledge that, you know, we're asking Vicky and Emma and their respective teams to put their shoulders to the wheel, you know, yet another time, when they're already, you know, they've been under huge pressure for over the last year. So I think, you know, we should just say a huge thank you to them both and to them all. And, you know, to reflect Trudy's point about in the midst of this, you do all need to stay well and make sure that you do get some time out. And, you know, because the temptation must just be to push and push until you can't push anymore. So please do look after yourselves and your teams in the midst of this. My only question was, in previous phases of vaccination campaigns, we've spoken about some of the more difficult to reach groups, you know, for example, the homeless, and I was just wondering how we're doing this time round with the booster campaign there.
So that point exactly was raised on the vaccination programme board yesterday, and is described under our inclusivity group work. That group, again now, because we've got some more capacity release because we're finishing off the housebound vaccinations, is going to meet on Tuesday. And we are liaising with all of the sectors that cover, particularly the client groups you've mentioned, Donald, including drug and alcohol service users and homelessness and everything else, to make sure that we reach all of those people in the same ways that we did with the first vaccination programme, which was actually really successful and gave us an opportunity to touch base and to make sure that all other needs were being assessed, and welfare was high on the agenda. So we will certainly be taking that forward again for this particular booster. And I think we're pretty clear, vaccination is going to form part of all of our futures for some time to come. So this is a really good test as to how flexible and responsive our services are, not necessarily just around vaccination, but around all the other care needs of the client groups that you've just described. And I'd just probably like to say on behalf of the team, thank you for your reflections on the demands placed on the team. The one thing I can say without a shadow of a doubt is we are surrounded by one of the best teams I've ever worked with. So we're in good hands. And we're also there to support each other and make sure that each of us does have a break at some stage over the festive period. So that's all well in order at the moment. She says, I need to touch wood somewhere because I said that last year, and every single public holiday of the last Christmas break I spent working on vaccinations, as did Shona and many other members of the team. So I'll go and find some wood to touch, and then we'll get back to our usual plans.
You know, just to go back to what you were saying initially, Vicky, about when we have to step down some non-essential service areas, although there are very few of them. I don't particularly want to ask what these non-essential service areas are. This wouldn't be the best place to let people know, but it's obviously going to be important that we communicate to people who are not perhaps receiving the service that they did previously, what the reason is. I mean, that goes without saying, I guess.
Yeah. Absolutely. And I wouldn't want anybody to get the impression that all of a sudden we're going to be stopping our normal kind of universal service provision that is provided. For us, the issue will come if we've got a really severe restriction of capacity across the team. And that would happen in any emergency event, when actually we would have to make sure that we were prioritising really urgent and immediate issues and the intensive needs of some of the people that we provide care to. And it may be that some of the kind of lower end of the spectrum, we have to reduce the number of hours or the number of visits. And if that was the case, it would be done on an individual basis. It wouldn't be a kind of blanket decision made across all of our service areas. And it would be done in conjunction with the individual user and the families that surround those users. So I guess that's the thing that I want to give an assurance around. We are not yet in a position where we're going to be making a blanket decision to stop some elements of service, but we may have to review the frequency and the level of care that we can give to some individuals, but only if that becomes the case where we've got capacity which is severely compromised.
Of course. I noticed Dr. David Shaw's hand was up, but it's gone down again. So I'm assuming that you don't. Oh, there he is. Yeah. Well,
yeah. Thanks. It was just a point that Vicky had captured, which is that we will be transitioning to making sure that there's protection extended to vulnerable groups. It's not just about mass vaccination, it's also making sure that the most vulnerable in our society are protected. And I would just want to reiterate that we have an extremely comprehensive programme that reaches out to make sure that we have maximal layers of protection. And although I think general practice hasn't been involved in this phase of the programme, general practice services will continue. And that is one of the essential services that will not be interrupted. We obviously do have our own pressures with COVID isolation affecting teams, but Again, the staff programme has enabled anyone clinical who needs boosted to be boosted, and that has occurred well in time. So I think we have made our services as robust as we can.
Thank you for that. Trudy, I think this will be the last question or comment before we move on.
I just wanted to say that at the very start of the COVID outbreak, the unpaid carers stepped up to the plate and really helped out, Vicky. And your comment about reducing the number of times maybe you have to go into homes to give care, I wondered whether we maybe need to do a communications thing out in the press, just to say how stretched the staff are, and give the unpaid carers maybe just a hint of why we're maybe reducing the visits.
Yeah, I've certainly come across some other partnerships who've done something similar to that, Trudy, and I think Angus maybe has recently, you know, one of our closest neighbours. I'm reluctant to do that though, because as I say, I don't think any of us would want to be in a position where we kind of were almost taking a generic blanket decision around some of those things. And you've mentioned something which is really key here, and particularly through the first phases of the pandemic. Lots of people, both unpaid carers, but also family members who wouldn't ordinarily have had a intensive caring role for their relatives, really stepped in and worked with us, you know, to ensure that their loved ones were cared for and had all the things that they needed, particularly in those early days where everybody was very anxious about, you know, the possible implications of the virus, as they are again now. What we don't want to do is not be cognizant of that. And lots of people who have had a really significant role throughout last year are also exhausted and need the support of the statutory agencies when it comes to the care needs of their family members. So I don't particularly want to give anybody the impression at the moment that we're going to be reducing care packages or looking to call extraordinarily on the role of unpaid carers or family members for that matter. But there will be individual circumstances where we basically need to have a discussion about that. And it's purely about whether we've got the right capacity in place. But as I say, at the moment, we have sufficient capacity across the system. And I don't want anybody to think that we don't. The issue for me, and I think I said it earlier, but I'll repeat it, is we are working to the very limit of what we've got at the moment. So any subsequent change, we will then have to have conversations with a number of people about what we can and can't do.
Thank you, Vicky. I'm very assured by that tack that you're taking.
Yeah, me too. I think the individualised approach is the way to go. And in conclusion, I'd like to also thank Vicky and Emma for all the hard work that you're doing, and of course all the people who, you know, the frontline staff who have contributed so much during the last phase and will be being asked to do again in this next phase. So thanks for that. And Willie, I think we can move on to the next item.
Yeah, thanks, Chair. Takes you on to item 6, the Chief Social Work Officer Annual Report.
Yeah, who would like to speak to this?
Thank you, Chair. I'll pick up on that. I'm very conscious of Annie's comments about perhaps having a session around Chief Social Work Officer's report, and so with that in mind, I'll probably keep my comments quite short. This report has also been to Dundee City Council's Policy and Resources Committee. Just for those who don't know, the Chief Social Work Officer's statutory role, and we're required to provide an annual report to the Scottish Government, which goes in via Dundee City Council, as the responsibility and duty still sits with the council to appoint the Chief Social Work Officer. So the annual report is really a reflection of the work that's gone on over the last year, and for this particular report it covers the financial year 2020 to 21, so it doesn't reflect right at this moment in time, but as a result of that it does reflect a lot of the work that went on during the pandemic and particularly focuses on that, and you'll not be surprised to hear that that's the aspect of it. And I think I'll just say 2 or 3 very kind of brief things. I think what it has shown is our ability to work in partnership across all of our services, and that includes children's services, community justice services, as well as services provided through the Health and Social Care Partnership and those that we commission with our third sector. It really has kind of shown that we've very much focused on how we can deliver things and continue to deliver in a person-centred way, and ensure that the kind of values that we kind of enshrine in terms of human rights and the approaches of equity have tried to continue throughout this particular period. We've absolutely adapted the way we work to ensure that we continue to keep people as safe as we possibly can, and to make sure that we are minimising the harm that could have come to people during the pandemic. And we knew that when we were stepping down services that we would have to look to see how we continue to provide the supports that we needed to provide to people like carers and families who found themselves working day in without the normal supports that we would have. So the staff, I think, really is the heart of the Chief Social Work Officer's report. It's what our staff do. It's how our staff continue to work in a way that demonstrates both their compassion and care for those that they work with, but also the professionalism throughout the pandemic and out with that pandemic. So I really won't say very much more than that. Sometimes I'll highlight some of the really good bits in it, but if you're looking to have something in more depth, then I'm happy to hold that back until then. But I would commend the report to you, and I would commend the work of the staff across all of our social work and social care services for the work that they've done over this last year. And I'm happy to leave it there, Ken.
Yeah, I would absolutely commend the report too, which, as you say, has also been to policy and resources. And I think I said there that it's a fantastic overview of the huge number of services that we provide to vulnerable people in Dundee, and providing social care and social work services in Dundee isn't particularly easy, as you will see when we come to the needs assessment paper. So well done to everyone, and thanks again for a very informative report, Diane. A couple of hands. Trudy, please.
Yeah, I have a few comments and one question, Diane. I feel it would be useful if you had a front page of an acronyms, particularly for members of the public who may read the report and new members of the IJB. That would be useful. On page 54, the care at home, I was really very pleased to see the partnership working and the sharing of skills and knowledge between physios and OTs. That's a really great way to work, and it's excellent for patient-centred care. I was very pleased with that. It's maximising resources available. Page 72, Employee Wellbeing Service. Very good to see the increased focus on staff wellbeing. It shows that we really do value our staff. Page 76 is a question, actually, Diane. Throughout the paper, there is mention of collaborative working between Angus and Dundee. And I'm wondering why P&K are not included in this collaborative working, because we should be working over Tayside. You can answer that later. I'll just go on page 79, Community Justice. I would like to commend the staff on their infection and prevention practice. I note there was no known transmission between service users and staff in face-to-face contact. This is a measure of the education and also the attention to care and protection staff have made in their day-to-day work during COVID. Page 80, the adult health and social care. Again, I would commend staff for so willingly agreeing to be redeployed to support the population during the pandemic. Their willingness to retrain also is commendable. Mention of Dundee City Council and of course primary care and our wonderful third sector need also be noted. Big thank you to all of them. So the question about why are we not working collaboratively with P&K, Diane, that's the only question.
Thank you, and thank you for highlighting the good points within the report. The development of the actual report is a collective piece of work, because we work across Children's Service, and I have to say that both Alison Lucas and Catherine Sharp put a huge amount of effort into getting this together in order to spool it. But we'll note the comments in regards to the appendix which details the acronym study. So I think in terms of this particular work, sometimes we get additional funding and sometimes we collectively work together. So we do quite a lot of work with Angus around our development of adult support and protection, and that's just the way it's always been. But I would say that the work that happens at a Tayside level includes Perth and Kinross, Angus and Dundee, as well as NHS Tayside. And actually there's a lot of work going on to develop Tayside approaches. So this particular tested change was done between Angus and Dundee. We have developed it, we've looked at it, it's relevant at that particular point in time. I wouldn't say that there was any particular reason as to why it wasn't done initially with Perth and Kinross. It's just the way that that happened in terms of the agreement to do the work, Trudy. But certainly when it came to the Tayside level and working across, then all of our partners engaged in that approach.
Good. A great report, Diane.
Donald's next.
Thank you, Chair. I agree. It's really interesting report, and it just gives a sense of the breadth of the activities that you're covering, Diane. So, you know, an interesting read. I'd also had the same point as Trudy about Perth and Kinross, and so it's assuring to hear that there are initiatives where you do work together, and you know, I certainly encourage that. I had one comment and one question. Just my comment, and it's really one for perhaps next year. The section 5, it's on page 6 of your report, starts with an overview of key performance indicators. And from a point of view of accessibility, that really does cry out for some graphics and targets and measures that would really just bring it to life, because there's a lot of rich information in there. But it would really benefit from being brought to life. My question was, and it's on page 30 of your report, where we talk about care home performance, adult health and social care. And right at the bottom of the page, the bit that caught my eye was that we're 28th poorest out of 31 partnerships for, you know, the proportion of care services rated as good or better in Scotland. Now, that took me aback a little, but when you read on, am I right in saying that our level is 80, the Scottish average is 82, so actually it's a very narrow range, and I think if that's the case, then we can probably draw a bit of comfort from the fact that there is consistency of delivery of services across Scotland. But am I reading that right, Diane?
Yeah, happy to come back with both of those points, Donald. Firstly, the report that we provide is worked to a template that's provided by the Scottish Government. So sometimes we're obliged to put certain information in, but we can certainly look at how that's presented, given that it does become a public report. You're absolutely right in regards to the kind of level of proportionate in terms of the good or better in Scotland. It is a very narrow band in terms of the work that's being done. The other thing to note is that actually there were only a few inspections undertaken. So for a number of organisations, they weren't inspected during the pandemic. And to be fair, probably those where we had maybe more concerns would have been inspected in terms of the issues that might have arisen and in regards to the pandemic and the approaches that were happening at that particular point in time. So it's probably not the best year to kind of do that comparison with, just because of the nature of the way inspections were carried out and why they were carried out. I think what's important to know is that none of the inspections, so say the performance concern inspection resulting in a number of requirements being imposed, and when most of those follow-ups were made, there was no actual other additional work that needed to be done. So some of that was about ensuring that people had the right things in place at the time during the pandemic. So lots of different reasons as to why we have the results that we have this time, Donald, but you're absolutely correct. It's a very narrow band in terms of the range of performance and how that is assessed across Scotland.
Okay, thank you, Diane.
Martin, you're next, please.
Thanks, Chair. Just a couple of things. First of all, an excellent report showing the depth and breadth of work that the social worker are doing in Dundee, and it's an excellent report in that respect. On big page 44, at the bottom of the page, the self-directed support options 1 and 2 table is a little bit of a pet peeve for me, is the way the data's been presented. Some columns you've got the figures down to the nearest pound, and other columns you've got it down to the pence, and it just looks a little inconsistent in terms of how the data is presented. Because I know we've been talking about graphs and tables and pictographic elements. I think this is something that could be easily tweaked, but it's just a little pet peeve of mine in terms of data presentation. Thank you, Chair.
Thank you, Martin. We're happy to look at that next year.
And before we move on to the next item, finally, we have Councillor Short.
Thank you. Diane, it's in connection with the custody unit, the community custody unit. I know that Perth and Kinross had a paper that went to their IJB because of the relationship with Perth. And I just wondered, because it says in there that there's a spring opening, will we have something coming to us at some point prior to the opening? Because presumably it will have an impact on Dundee having the unit in our IJB area.
Yes, certainly, Councillor Short. Derek Aitken's on the call, but I think I can probably respond quite directly to your question. So I think we would be happy to bring a paper to the IJB describing the work of the custody unit, the women's custody unit, how we will be supporting that. There will be aspects in regards to health and social care that will be relevant to the women who will come into that centre, as well as things to do with community justice and children's services, and we're involved in the developing of that service. It's certainly something which, from a community point of view, caused quite a lot of debate and discussion at the time. And I can see Bailey Wright nodding her head, because I chair the Coleside LCP, and it was quite an interesting night when we had an open discussion in regards to the development of the service. But I have to say the benefits have been supported by Dundee City Council as to why we felt we needed to bring it, because it's really important for the women from Dundee in particular that they have this opportunity to be reintroduced back into the community in a very supportive way. So I'm happy to ensure that a paper comes to the IJB in the future.
Yeah, that's excellent. And my admiration for Bailey Wright will never dwindle with regards to that, because it was very, very much a case of something that I know that she's talked to for a long time. And yeah, it was very, very good what happened that night. So yes, thank you. And thank you for bringing it.
Yeah, there's certainly no element of NIMBYism and Bailey Wright's approach that night. Commendable. So this is... Now, I've already opened the next paper. Obviously, that the Chief Social Work Officer's report was obviously just for noting, so we can move on to item number 8, Willie.
It's item 7, Chair. Bill Agency Protecting People Governance Arrangements.
Okay, this is me. This paper has been submitted to the board in response to one of the actions from the action tracker, where there was a request for further information to be submitted about our governance arrangements for public protection matters. So I think the report's fairly self-explanatory, hopefully, but it obviously gives an outline of our governance arrangements for public protection across the community planning partnership, including detail on the role and the process for appointment of independent chairs within that structure. The report includes an outline of interfaces and the detailed reporting of the public protection activities and performance within the IJB structures, as well, to help to link that to the board's own responsibilities. I'll not say any more than that, Ken, by way of introduction.
Good paper. I'm certainly feel that the governance arrangements that are in place are robust, and that every angle is covered. I don't know if anyone else has any questions or comments. Donald?
I just had one question on the composition of the group, and it's spelt out in 4.2, but the name that I thought was perhaps missing was the Scottish Ambulance Service, unless they're wrapped in some other way, because you just felt that, you know, often they can be the first point of contact with people who are in need of our services. So I don't know if we're missing a trick there or whether it's caught in some other way.
So the Scottish Ambulance Service are not members of the Chief Officers group, which was obviously our kind of highest level multi-agency governance group around public protection. I'm going to ask Diane if she knows. I know the Scottish Ambulance Service have been involved in the Adult Support and Protection Committee in particular pieces of work. I'm not sure if they're full members of the committee. I don't think they are, but they have been involved in particular areas, particularly around practice reviews in the past. So I'll let Diane in.
They are not currently a full member of the Adult Sport and Protection Committee, but we have been discussing a review of the membership recently and agreed that that might be an area of work that we would want to engage with. I think at this point it might be difficult in order to free staff up to attend the meetings, Donald, but certainly we feel that that is a gap at the Adult Sport and Protection Committee as well.
Yeah, I think you made a good point there, Donald, because when I was reading the paper, I was trying to find a gap and I couldn't, but obviously the ambulance service would seem to be a fairly obvious one. So it's good news that the membership's been reviewed. But as you say, Diane, at this point in time, freeing people up for meetings isn't easy. Martin.
Thanks, Chair. Just a very quick one again on data presentation. It's on the big page 99, the Appendix 1 chart. It's a little difficult to follow in terms of the overall colour scheme. Is the colour signify anything? It's just there to break up the appearance of it. How does the Protecting People Strategic Support Team function? Do they connect? It just for me it doesn't read well. And it's probably the comment I want to raise on that one. It just doesn't feel like it's making much sense to me, reading it from an outsider's perspective. And that's all I wanted to say on that one.
Would anyone like to pick up on that?
That's helpful to hear that comment, Martin, and we'll take that on board in terms of how we present the information next time. I suppose if it's read alongside the report, we hope that that would just help for people who like a visual representation rather than a narrative representation, but we'll have a look at that for future reporting.
Thanks for that. Sorry, I'm getting a wee bit mixed up with my papers now because they're a wee bit in the wrong order. Yeah, that was for noting, so we can move on. Thanks.
Yeah, thanks, Chair. Okay, item 8 then proposes leadership of public protection arrangements. Vicky like to, or Catherine?
It's back to me, Chair. So obviously this follows on to some extent from the previous report. This is what hopefully will be becoming a familiar report to the board members now, our 6-monthly update in relation to the work of the Chief Officers Group, which the Chair and Vice Chair of the group submit to the Council, NHST side and IJB for information and consideration. Again, it's quite a long and extensive report. It covers, actually this time covers a 9-month period. We've been slightly delayed bringing it back, but it covers a lot of detailed information about work that's been undertaken in terms of pandemic response, but also more broadly business as usual, public protection activity across the multi-agency partnerships. There's just probably a couple of things I would pull out by way of highlights at section 4.3.3. There's some detail about the investment of COVID remobilisation monies that were made available both by the Health and Social Care Partnership and Dundee City Council, which have been invested in third sector violence against women services and have made a very significant difference in terms of reducing waiting times for access to support for some of the most vulnerable and at-risk women across the city. Obviously, there's been a significant focus on the joint inspection of services for children at risk of harm over the last 6 months. And there will be further reports come to the IJB in the new year in relation to the findings from the inspection and follow-on activity from that. And the other aspects that's probably particularly of interest to this group in relation to young people, including transitions into adult services, is the work that's reflected in the report around our focus and improving that area, and a seminar that took place recently in relation to exploring contextual safeguarding as a model to help us to better support and understand the risks for young people and as they grow up and move into adulthood, and how we can work across partnerships to address and support that group of young people and the vulnerabilities around that. So again, I'll leave it at that. It's a long report. I'm happy to take any questions.
Yeah, one thing that really stands out for me is that the improvement in service for users of Dundee Women's Aid and RASAC Women's Rape and Sexual Assault Centre. You know, during a pandemic, you might have expected to be going in the other direction. Has it actually been easier to provide counselling and therapeutic and counselling support via remote means like this? Is that perhaps one of the reasons?
I think there has been some feedback for some women that digital interface has enabled them to access support more easily and be more comfortable in doing so. There's something maybe about that slightly more remote interface that's made it easier for some women to share obviously very difficult and distressing experiences and receive support that way. But as always with these things, Chair, there's also some people who've reflected that that hasn't been helpful and they've wanted a return to face-to-face services. So it's about getting that balance. But certainly services as across all areas have had to adapt and have a more of a blended model. But there has been a lot of work to try and maintain a level of face-to-face services across third sector for these particularly at-risk groups as well.
Thank you for that, Catherine. Bailey Wright would like to come in.
Thanks, Chair. I really welcome this report. I think this is really very important, this report. I mean, it shows us exactly what's going on in the services. And at 4.3.3, I certainly welcome the huge reduction in the waiting times for women seeking support with domestic abuse and sexual violence. Obviously, it's been achieved by COVID remobilisation funds being used to provide additional third sector staff. My question is, how secure are these posts given the source of the funding? And are we expecting a subsequent rise in waiting times if or when COVID remobilisation funds actually dry up? Are we relying on these funds?
Good question.
Yeah, absolutely. So in terms of the Women's Rape and Sexual Abuse Centre, they've actually been able to secure, using the COVID remobilisation money as match funding, to secure other sources of funding to extend the additional workers that they've appointed for a further year till March 2023. So that's been helpful. They wouldn't have been able to secure that investment without having the match funding available. So that's helpful. In relation to Women's Aid, they have used the opportunity to test a different approach to providing a duty outreach service, and there's learning from that they intend to apply post-COVID remobilisation monies being available if they do come to an end at the end of this financial year. So it's actually given the opportunity to look at remodelling the service in a way that will impact on the waiting lists times beyond that period. The Violence Against Women Partnership have a significant role in terms of monitoring those areas, and there's, in terms of public protection, we have a strategic risk register, and waiting times has been part of the area they're monitoring. So beyond the lifetime of the funding, there'll also be really close monitoring of any change in waiting lists, and an opportunity to escalate that back to the chief officers and to consider how we might approach that as a partnership for the longer term, if there is any subsequent rise as well. Bailey Wright.
Can I thank you for that, Catherine? Can I thank you for this report? I can't emphasise enough about these important services, and I'm quite pleased. I mean, we do work well with the third sector, and I would hate us to put this in place and then discover that we've not got funding. So I'm pleased to hear that the third sector has got funding, because they do such a great job for us. Thank you.
Yep, and can I bring in Eric Knox now, please?
Yeah, thanks, Chair. It's just to pick up on Bailey Wright's point as well about third sector services. And I think there's a general concern, and I echo some of the concerns that you raised there, Helen, in connection with it. Just there's been a lot of money coming down through various routes, and some of it hasn't been well thought out by the government, the way it's come down. So it's not necessarily always getting to the right areas, and that's because of the nature of what we've been dealing with over the last while. But my concern, I've raised it in a number of forums, is that longevity for third sector and sustainability for third sector, when the money starts to dry up, which it will do, the money's got to be clawed back at some stage. And my plea is that it's not the third sector that is always the place that people look at first, because some of the services that we provide, and you've highlighted some there, are critical services for delivery in the city, and without them people would suffer. So I think it's a really, really important point, and I think it's one the IJB has to be aware of going forward, not just for this area of work, but right across the areas that the third sector affects the IJB's work, and that's just about every single area, to be perfectly honest. So I think it is a worry, but we are looking at it and lobbying nationally in connection with that as well.
Thanks for that. There are no other hands, and I'm losing the place again a wee bit here, but yeah, that's just for noting. Yeah, that's just for noting. so we can move on. And it's the next item I'm having trouble with, which is item 9. I'm not sure I've got that here.
The item 9 is Dundee Health and Social Care Partnership Strategic Needs Assessment. It's page 123 of your agendas.
Oh, that, yeah. Just wondering if I can, just give us a second till I find it, please. Or maybe someone could start talking to that, please.
Yep, I will do. So this report is seeking the IJB's approval of our revised Health and Social Care Partnership Strategic Needs Assessment, which is a companion document to our Strategic and Commissioning Plan, and also of the Carers Strategic Needs Assessment, which is required under provisions in the Carers Scotland Act to inform the Carers strategy. As has already been noted, this particularly the overarching strategic needs assessment is a very long and very detailed document, and I'm not going to attempt to give any level of summary of it in this call, and noting that people have requested that perhaps we think about a development session, which would probably be more appropriate for sharing the details of that. The Strategy and Performance Service have worked hard with partners, including with Public Health Scotland and others, to review the overarching strategic needs assessment with the latest information that's available, and bring it up to date. And they've also been supported by the Strategic Planning Advisory Group in relation to that. Because it's such a long document, we've also this time produced a summary version to try to have a shorter and more accessible public-facing summary to accompany the full document, and intention would be to publish that, if it's approved today, alongside the full version on the website. The similar approach has also been taken for the Carer Strategic Needs Assessment, so there's a full document and also a short infographic summary to try to aid accessibility for stakeholders, including for unpaid carers themselves and other members of the public who may be interested in this. As with all strategic needs assessments, as soon as we write them, they're out of date again and new data comes on board. So just to assure the IJB members that we do continuously look at updating, but approximately every 2 to 3 years we try and do a full refresh and bring it back for approval. So obviously happy to take any questions.
Yeah, it certainly makes for. I can't find it. I must have closed the document, and I don't want to try and reopen it in case I close the whole lot down with my 2 laptops set up here. But yeah, it makes for quite somber reading, and when you look at the infographic as well, you know, the number of challenges that we face in Dundee is incredible. There was just one thing that I remember seeing that surprised me, and it was relating to the number of people living with hepatitis C in Dundee. I'm pretty sure the figure was 2,400. Like I say, I haven't got the document. I can't tell you what page. I thought we'd done so much good work with Hep C, world-leading work, that figure surprised me. I wonder if anyone would like to comment on that, because I wouldn't have thought there were 2,400 people living with Hep C in Dundee.
Not something that I've got the detail of, but happy to find out a bit more about that, unless there's anyone. Diane, I can see Diane's going to.
I was just going to echo what Catherine said, Councillor, and I'm happy that we take that back and speak to Public Health just to determine what the absolute position is, because like yourself, certainly we've been very proud of eradicating Hep C in the city, so need to just go away and confirm that. Well,
actually, that's the word that was used. I remember in a press article, you know, some time ago, the word eradicated was used. So when I saw the figure of 2,400, it kind of didn't make sense to me. But so yeah, we can take that out with the meeting. But I would like to figure out I would like to hear the true picture. Maybe 2,400, but hopefully not. Now, next up is Trudy.
Yeah, mine was on Hep C as well, Ken, but often at the board meetings, the NHS board meetings, we talk about our you know, how we've eradicated Hep C. So I was a bit concerned about that as well. But also, I liked the Appendix 3, Catherine. I thought that was very stakeholder friendly. Yep. And it's short and it's easy to read. So I commend you on that. I think it's great. It was a great paper overall, but throughout the paper, the link with deprivation and poor health is really evident. You know, addiction, social quality of life, early death, emergency bed day rates, all linked to deprivation. So until we eradicate poverty in Dundee, we're still going to have problems throughout my lifetime, I would suppose. because the deprivation is cited in almost every single page of this document. So they're contributing, that's contributing to obesity, diabetes, all sorts of things. So I think that's a real problem for Dundee.
Very much so, very much. Martin is next. No, sorry, Annie Buchanan's next.
Hi, because I'm still finding my feet, the whole point of doing the strategic needs assessment is in order to inform our commissioning, yeah?
Yeah.
So that's why I would appreciate some bespoke time. Catherine, if we have to pass this today, I'm happy to do it, but I don't really feel that we've been able to get underneath it and some of the points that Trudy's just raised. So because it's about informing commissioning decisions, which is what we are kind of accountable for, I really would like some dedicated time to understand how that, because when I was reading all this, I was thinking, it's great, but it's the so what do we do with this? And we commission services based on that information. So I just can't help thinking there's so much in there and it's fascinating. And as I've already said, a bit depressing, given I'm a Dundonian. I would love to have some bespoke time, but I wouldn't hold up passing it, God. You know, agreeing with it today, if that makes sense.
Yeah, happy to look at something appropriate for that, and also just to say that in the new year there will be papers coming to the board in relation to the statutory review of the strategic and commissioning plan, and that will help to make the link about how this revision of the strategic needs assessment has informed the strategic plan and advisory group's work in relation to the review of the strategic and commissioning plan and the recommendations that they'll make to you in relation to that in the new year. So that should help also to link this to how that actually influences strategic planning and commissioning.
Martin's up next, please.
Thanks, Chair. You make me be surprised by what the point. The thing on the strategic needs assessment was on the carers section, and what for me, one of the things that the paper showed to me was how accurate it is in terms of what carers are suffering, how they're having to deal with some of the issues. Now, we mentioned earlier in the meeting about service delivery coming up to the maximum limit that it's possible to do, being very stretched. And just want to say that carers really are stretched now, and we are getting to a position that in terms of carers that we don't feel that I personally don't believe that carers have got much more capacity within themselves to deliver the services, and it's good to see in the report that what my thinking is being matched up by the report, and I just think it's been a very well written report, and I would like to commend Catherine for her work.
Thank you, Martin. Can I bring in Donald next, please?
Thank you, Chair. I mean, similar to Annie, I think it's something that does justify more time than we can really afford today. I'm, like her, I'm certainly happy to approve this. I mean, it is what it is. The work has been done, and it does present a fairly depressing picture in many ways. So I think the focus that I would like to see, if we're going to have this board development session, and I think we should, is linked to these issues. What are we doing and what more can we do? And also to look at, what are the dependencies? Where are we dependent on other agencies, other places, other sources for us to be able to achieve what we want to achieve to solve these problems? But, as well as Bailey Wright's just said, well done, Catherine, for a really an interesting read and something that we can and should make use of.
Absolutely. Cough and fit, sorry. I hope it's not COVID. Linda Gray is next, please, and then we'll wrap this up and move on.
Yeah, thanks very much. Plenty of other people have noted how robust and how detailed this report is, and I just wondered what the opportunities are for us linking into wider strategies, for example, long-term planning with Dundee Council, if we've got opportunities there for linking into a wider city picture.
Yep. Just before I respond to that, Linda, I must say that the work is done by the strategy and performance team, who I support. So there are a number of officers in there who deserve the credit for these reports, not myself. So I'll pass on your comments to them. In terms of linking to planning, absolutely, Linda. So we've actually this week, in the last couple of weeks, been holding some stakeholder consultation events around the statutory review of the strategic plan, and through that discussing with a range of partners how we might link into particularly the forthcoming review of the Dundee City Plan, across community planning partners, but also other strategic plans that tackle some of the key issues that are highlighted in terms of the strategic needs assessment, and trying to align our planning cycles better across not just Dundee but also across Tayside. So that's something that we're trying to work through as we go through this statutory review of our own strategic and commissioning plan, Linda, and partners are also very keen to work with us on that. So it's certainly a two-way conversation.
That sounds really encouraging, and you know, we could maybe be a model for other cities. Good planning, thank you.
So as I said, I don't actually have that paper open, but from what people have been saying and from what's pretty obvious, it needs to be approved today. So can that be approved, please? If I don't hear any dissent, I'll assume that it is approved. Having taken into account, obviously, the comments that have been made, particularly by Annie. Thank you for that.
Okay, thanks very much, Chair. Item 10 then, before his trauma-informed practice and leadership report.
Yeah, who's going to?
I'll start off, and I think Diane might want to join in. So again, this report is coming to the board in response to previous requests for further information around our approach to trauma-informed practice and leadership. We had hoped, working with the Improvement Service, that we would have been able to offer the IJB members a development session around trauma work and follow that up with a paper, but because of some of the national timescales that the Improvement Service are working to, that hasn't been possible. So we're bringing this paper now, but just to note that we do intend in the new year to work with the Improvement Service to offer a development session to IJB members around these areas of work. The first part of the paper provides an overview around psychological trauma, kind of theoretical overview, so I'll not go into huge detail in relation to that. And the rest of the paper tries to provide an overview for the board of our strategic arrangements for progressing this work within Dundee, and that's primarily done through our Dundee Trauma Steering Group, which is a partnership between the Council, the Health and Social Care Partnership, and actually third sector services, looking at a kind of strategic approach for trauma-informed practice. That group is currently working on a detailed implementation plan for what is quite a complex area of work. So implementing trauma-informed practice is quite an expansive and complex programme across multiple agencies. So we're trying to really focus on our priorities for implementation and make sure that we've got clear timescales and impact measures for those. And once that implementation plan has been agreed, that can be brought back to the board and shared with you for your information. Whilst we've been doing that, there has been a whole range of progress, which is outlined at section 4.3 of the report. That includes the identification of trauma champions, and Diane McCulloch is one of those champions from a health and social care perspective, and also some tests of change which overlap with the responsibilities that are delegated to the IJB. So there's one around care homes and others in relation to employee wellbeing and domestic abuse that are detailed within the report. Looking forward, some of our key priorities are around trauma training mapping and looking across our health and social care workforce to identify who requires to be trained at which level. Further training for leaders, including the IJB itself in that development session that I highlighted, and as I said, completing that implementation plan. And thinking about how we allocate recent monies from the Scottish Government, which have been directed to local authorities to support some of the work with partners to implement this. So Diane, I don't know if you want to add anything to that.
Yeah, thank you. Catherine summarised that really well, but I would probably want to highlight the team that works around our approach to trauma-informed were recently invited to go and speak to Scottish Government in terms of ministers and civil servants from the government, basically because it's being seen that Dundee is actually progressing the work that needs to be done really, really well, and actually its range and involvement of such a wide range of stakeholders has been viewed as a really good way to take things forward. So we just want to acknowledge the good work of the team in taking this work forward. I think the other thing to say is that we're seeing more and more that documents that are being delivered and produced at a national level are recognising the impact of trauma-informed practice, and they need to kind of look at that. And to some degree, that could mean an overhaul of the way we deliver our services, of where we deliver our services, right from the beginning, at the point of contact with our organisation, through to how we support people as they're leaving our organisation and our service deliveries. I think the other thing to highlight in the report is the aspect about the fact that a number of our staff will have been affected by trauma, and we need to think about how we actually then take that into the way that we work with our employees. So a huge range of issues. We're just expecting a policy guidance to come out in regards to social work and social care, particularly for social workers, around an approach to trauma-informed practice, which will include particular information around newly qualified social workers. So this is really starting to, quite rightly, be prominent in a lot of the work that we do.
Really pleased to see this work progressing, because if you're looking back at the previous paper, the needs assessment, there's plenty of trauma out there for a lot of people in our populace. So it's good to see that we're at the, we're leading up this really important work, and that's without even taking into account the impact of COVID over the last almost 2 years. So yeah, really important work. Great to see it progressing. Councillor Short.
Thank you. It was when Catherine mentioned the improvement service, myself and Bailey Wright went to a trauma event from the improvement service last week, and I hopefully Helen will agree, I found it really informative, and something that was really kind of quite moving about it was the fact, and this is not me volunteering by any means, but one of the people who spoke was a lived experience counsellor who was a trauma champion, and I think that gave it extra sort of kudos, and I've had various conversations with around trauma, and the fact that professionals and people in a place that they're seen as one thing, but if they bring their lived experience, it almost changes the conversation. And I think it's so important that we do acknowledge that. And you say to someone of my mum's generation, where were you when JFK was shot? And it was a moment in time. My generation, it was probably 9/11, but for my son's generation, it's 2 years almost. And so, that trauma, if we remember these things that were just seconds, imagine what impact that's having on the generations now. So really, really good to know that, as Ken says, that, COVID is as big a trauma as we'll probably ever have in our lives. So thank you for this work. It is really, really important. And it would be good if we got everybody to see that improvement service thing. I think hopefully Helen would agree.
Bailey Wright.
Yeah, I would agree with Lynn. Sometimes we go along to these things thinking we're going to sit with our screens off and our mics off and not take part in very much. But I actually found the opposite. I just was so amazed with some of the work that was going on, and the fact that they had a trauma champion, somebody who actually was watching this space. I thought was a good idea. So yes, it is important work, and I don't think over the last year and a half that I know of that I've not spoken to somebody who has actually in the last year and a half suffered some sort of trauma with the lockdown period, and I think it's affected more people. Probably everybody's been affected in some shape or form in some way. Thanks.
Certainly affected me. I'm despondent, to be honest. But anyway, that's somebody will have to talk that through with me. So that's no more hands. we are asked to note the content of the report and instruct the Chief Officer to provide an update report no later than April 2022. Is that agreed? Thank you.
Okay, thanks very much, Chair. Item 11 then before you is the financial monitoring position as of October 2021.
Dave, would you like to?
Thanks, Chair. I'm going to pass on to Christine Jones, who's going to take you through this one in particular.
Yep.
Yeah, thank you. Yeah, this is our regular financial monitoring report that we bring, detailing the projected position as at the end of October for this current financial year. It is just for noting, so I'll try and be fairly brief and we'll get through this one. So based on the figures at the end of October, we are projecting a financial underspend of 576,000 for this financial year. Details of the breakdown of the different services are in appendices 1 and 2. So obviously if there's any comments, I'll take those. If not, the information is there for you. Just a couple of little points just to note, having moved on from sort of previous reports. As detailed in section 4.5, we are submitting quarterly financial returns to the Scottish Government. Our Q1 feedback from that financial return was received, I think, during October. And the majority of that had all been approved, with a couple of things that were just subject to further consideration nationally by Scottish Government. With our reserves that we brought forward from last year, plus some additional funding that we have received this year, we are currently holding about £6.75 million of COVID funding, with a projected spend at Q1 of 7.3, with the other parts just to sort of further review by Scottish Government. Our Q2 return was submitted during October, and that was projecting a spend of 7.7 million for this financial year. In total, obviously, a few things had changed from end of Q1 to Q2, and these returns are still being reviewed by Scottish Government. But we continue to assume in our financial projections that all of the additional COVID spend in the current financial year will be covered by additional Scottish Government money. And just one other little point just to make, in section 4.8, and this is obviously detailed more in the next paper that we'll be looking at in the next agenda item. We are receiving additional Scottish Government money, details of the different initiatives, the new and expanded programmes and initiatives that are going to be developed through the rest of this financial year and into future financial years. As at the end of October, we didn't really have an awful lot of detail about that, so our assumptions at that point didn't include any additional spend, but obviously any additional. So obviously, as we go to the next financial reporting, we will start to incorporate that. But as at the end of October, we've not included any additional assumptions for this because the details weren't really there. But obviously, we do expect any additional spend to be covered by additional funding, so there won't be a detrimental financial impact in terms of the current financial year. So it won't make any bottom line impact in a detrimental way. So if there's any, I see there's a couple of hands up, but
a couple of hands. Okay, Bailey Wrights first.
Thank you, Chair. Christine, I was just wondering about the reason for the 6.5, the underspends that you spoke about first. I'm not sure it was the 6.5 million, but my concerns are on the risk assessment on page 346, because the risk is quite high, and the comment on risk 1 that we might not be able to deliver a balanced budget over the financial year, that worries me. So I don't know if you can answer that.
Yeah, I'll have a shot, but I think Dave might come in as well with this one. It continues to be that longer term financial impact in future year balanced budget. Obviously, we came into this financial year with a reasonable gap, which we've been able to address, but through a lot of that has been through non-recurring savings. So we've obviously got that longer term future impact. And as we go through the next few months, we'll be developing our budget for future years. And obviously that'll start to be addressing that, but that underlying longer term or medium term and longer term risk. So our current financial year, we are projecting an underspend. A lot of that having been from things perhaps stood down or things like transport, supplies, because we're all obviously all working at home. You know, just different combinations of different things at different stages of the pandemic, and additional costs being for things that have been escalated and enhanced, have been built up and funded from sort of additional COVID funding as a response to the pandemic. But,
Dave, would you like to comment?
Helps.
Yeah, so thanks for that. Yeah, just to add to that, I mean, Christian's right in terms of the sort of kind of looking at the longer term as well. I suppose we always kind of take the cautious accountants approach. So until we're kind of very kind of at the end of the year, we're always kind of worried that something comes in out of the blue to hit us. We're obviously kind of moving into yet another period of uncertainty around COVID and the additional expense that may come through that, albeit. And again, Christian mentioned the next item on the agenda that we have some comfort with some of the additional investment that's around. But until we are we are absolutely confident that all the commitments that are set against that are completely covered by the funding, plus the absolute shortfall, the shortfall that we've got at the moment in our COVID mobilisation plan is fully covered. Then we'll continue to think it's prudent to highlight that risk to you as a board, that we can tip into an overspend position, although it's looking less likely than that's going to be the position now. But until we are a bit more confident, I'll not be changing that risk level at the moment.
Okay, thanks for that to you both. But I'll certainly be watching this space, as you would expect.
Never want to throw caution to the wind, are you, Dave? Donald is next.
On a similar theme, really. I mean, I did think Bailey Wright has a point around the risk level, and whether the assessment is starting to lag behind the position. It's either that, or perhaps the risk at the moment is very much focused on a balanced budget over this financial year. And I wonder whether the description of the risk needs to change to have a more long-term focus. Because, I agree with Bailey Wright that it feels to me that the risk in the current year is starting to reduce a little. And it does then feed into what was my main question, which was really more around the reserves, where they are becoming quite complicated now because of the process that we're following. And on the face of it, if you just look at the raw numbers, it seems like we have quite strong reserves. Now, I know it's not as simple as that. There's this mix between committed and uncommitted. And we're looking at an underspend for the current year of 500,000, which, if that materialises, will then just be added to reserves. And I suppose as a health and social care partnership, the ideal position would be for us to get to the 31st of March with a number of 0 as being your budget versus actual. So I do wonder whether we need to think about that. In particular, I don't know if we have a reserves policy that suggests the level of reserves that we would like to hold, but I wonder whether this is a time where we should be revisiting that and perhaps thinking about how it's affected by this change in the way that central government funds are passed down to us. So I'm reluctant to put something else onto Dave's to-do list, but I think the rules around reserves have changed, and I wonder whether we need to take another look at our reserves policy to make sure that, 1, we're not underspending, 2, we're not overspending, but we are being prudent in maintaining reserves. So that a slightly rambling question, but around reserves policy.
I think our ideal figure is 5 million, isn't it, in reserves?
Yeah, absolutely, Chair. I mean, we've got the reserves policy is for is to have reserves of 2% of budgeted expenditure, which is around about the 5 million. So that's always the threshold that we've looked at, and it's obviously at the moment we've got quite a significant amount of reserves. But as you say, Donald, some of that is well, the majority of that is actually kind of earmarked for certain things, which is mainly actually around Scottish Government funding. So whether it's around COVID, primary care, Action 15, ADP, etc. So they're not in effect free reserves for us to use. In effect, what we've got is around about 2 million of that reserve that is a kind of general kind of non-earmarked reserve for us to look at. So it's that figure that I would be looking at in respect of the 5 million, if you like. So the 2 is against the 5 in terms of the target. The idea of IJB's being able to hold reserves is to be able to support transition from, in terms of kind of service change in particular, and to, of course, anything that comes out of the woodwork that we're not that we don't know about, that'll hit us. And when we come to the budgets development sessions for next year in particular, there are 1 or 2 things that we need to consider in terms of how we're going to fund some that are kind of one-off, kind of short-term issues that we need to take into account in terms of our future reserves kind of balances and reserves planning around that. Excuse me. So yeah, there's a fair bit of we've not really been in this position before where we've had such a kind of wide range of complex reserves. Notwithstanding what I've just said in terms of the risk assessment and where we are, I still think we might have further reserves come the end of the year, given that the scale of the new monies coming in. Again, we'll come to that at the next item. And it just depends how quickly we can spend some of that money to put in services in place to meet the Scottish Government's expectations around that funding too. I think going back to the risk assessment, I think again, fair points. We've maybe been too cautious in that approach in terms of whether that should really kind of cover, just set out kind of more of a kind of longer term sort of risk. I would be probably reflecting that more in the budget paper that we take at the end of March in terms of that being the risk, will this continue to be an in-year risk assessment process. But again, take the point, we're maybe for some thinking we're a bit too optimistic, too pessimistic in that regard. But yeah, we'll review that for the February reporting.
Yeah, having listened to what everyone else has said, I think you probably have been a bit too pessimistic with that risk rating, but we'll see what happens in February. Raymond, you're last up for this item.
Thanks, Chair. I think Dave's covered most of what I was going to be asking, which is a bit like we're in a bit of deja vu again, Dave. We're expecting to have more conversations around what happens when you come out of COVID, but unfortunately we're back in it again. And I think we do need to be planning ahead for that long-term kind of thing to say, well, what's the future going to look like? And bearing in mind that there may not be as much money as ready available, and we need to look back at what was the risks pre-COVID, and are they still there? Will they still be there after COVID? And look at that long-term thing and what's the impact on our staff and that sort of. So yeah, so I think you've covered some of that anyway, Dave, about looking forward in February and what that looks like and planning. Thanks.
Okay, thanks everyone for your contributions. This item is for noting, so we can move on.
Thanks very much, Chair. Takes you on to item 12, the Scottish Government Additional Investment Winter Planning for Health and Social Care. I'd just like to bring to members' attention that in addition to the recommendations you've got listed there, you'd also be required to instruct the Chief Officer to issue directions to Dundee City Council as indicated in section 8 of the report.
Okay.
Okay, thanks for that, Willie. So yeah, this report kind of sets out the investment that has been provided by Scottish Government, as we've kind of alluded to in the financial monitoring report. So beginning of October, there was an announcement of an additional £300 million to be invested in health and social care to support. It was kind of badged up as winter planning, but also kind of acknowledging that there's a longer term kind of impact of sustainability around the system. So it was too early at that point to bring anything to the October IJB because it had just been announced. and since then we've been getting a bit more further information around what the investment is actually for, and in effect the sort of kind of rules around what we can and cannot spend that money on, and indeed kind of the actual individual allocations per integration joint board as well. So we don't have all of them yet, but we're it's certainly getting kind of clearer. Every couple of weeks there's another announcement on what that actually means for ourselves. And within that, kind of set out at 4.2.1, that there's a kind of range of the investment announcements that have been made, which will kind of directly impact on health and social care, i.e. money that will come directly to us, but also money that will kind of be routed through NHS to side, of which we will be eligible to kind of take our share of, whether it be in terms of kind of the recruitment of support staff. So there's an amount set aside for further recruitment of I think it's 1,000 health and social care workers, and across the country, and of which there's a kind of an allocation in effect for each health board area and indeed an integration authority area. So we're kind of working through with NHS to decide on that at the moment. It's quite a significant investment around enhancing care home capacity. So this is all around kind of trying to make sure that the system around kind of delays in hospital or prevention of people going to hospital, that there's sufficient community resilience within our services to enable that system to continue to be as clear as it can over the winter period and beyond. Now that we've in effect got a kind of new normal level of higher demand than we've had previously. In addition, we've got kind of interim step down care. So that's again trying to kind of improve the flow from hospital, and in particular using care homes to provide that step down kind of shorter term support before service users would then kind of be moved on to a kind of more appropriate longer term support there. One of the big ones that's there, and it kind of follows on from the increase in social care pay, which so from 1st of April, social care staff in our externally provided services went from I think £9 to £9.50. In order to try and kind of retain and recruit social care staff, Scottish Government have kind of further injected funding into the system, and have asked that we all increase payments further from that £9.50 up to £10.2 per hour. So that'll then become the minimum kind of hourly rate that a social care worker would receive within our externally provided services. So so there is funding has been announced, and we have got our allocation of £1.384 million. The contracts team have been kind of working through the Scottish Government guidance and engaging with providers on how much that would mean for them and what they have to do to receive that funding. In terms of kind of overall governance, Scottish Government recognise that actually if they do allocate this money to IJBs, there's a governance issue here that needs to kind of IJB approval to then kind of implement that policy. So that's why we put in the specific recommendation today, that's approved, and that will allow us to kind of make the payments out, which will enable the social care frontline social care staff to receive that uplift, and it's backdated to 1st of December. So we are continuing to kind of work through say the detail of that funding, and it kind of ties in with the budget, the longer term budget for next year and beyond, because a lot of this funding will be recurring and actually forms part of the budget announcements for 22-23 that were just made last week. And again, I can come to that on the budget update session as well. So it's generally for kind of for noting and for information to the IJB, but also that request to approve the release of funds to pay the £10.2.
Certainly, this money's welcome, particularly money to recruit more staff. But I do wonder how that's going to work, even at £10 an hour, particularly in a city like Dundee, which has so many hotels, and the hotels probably aren't going to go away now because we've got the Eden project coming, so we're competing with other sectors which are paying the same or more for what's maybe an easier job, like sitting in a hotel reception desk or something like that. Donald first, please.
Thank you, Chair. I mean, I do agree with you, Ken, on that first point. My question was actually slightly tangential to going back to something that we discussed quite a few meetings ago, but I'm not sure that we ever bottomed it out. And it's in relation to people who are working for the independent care providers, and this policy on whether these people working in those sectors are paid for the time between visits. And I'm glad Jenny's popped up, because I think it was Jenny, you were going to do some thinking about this one. So I'll stop there and let Jenny give the answer.
Yeah, we've been doing a bit of work on that, Donald, and we're going to bring a report back to the next IJB. It's just in draft updating, so I'll probably not give you all the detail of what's in that just now, if that's okay.
Perfect. Thank you, Jenny.
Next up is Trudy, please.
Yeah, I was really pleased to see the enhancing care at home capacity bit 4.3.2 in the technology enabled care. And I have been to some care at home seminars, and they've spoken about things like handheld ultrasound machines that communicate immediately with the patient's case, notes held online in the acute hospitals or at the GP practices. GP can get immediate blood results and things like that. So in the future, I think we're maybe going to have to think about expanding into that area. And I feel that perhaps there's a need for some staff education or exposure to some of these care at home meetings so that they can see what's happening in other areas of the country.
Yeah, thanks for that, Judy. I mean, we do have kind of quite a lot of work around technology-enabled care, but I think we're recognising that we don't have, I don't know, prior to this investment coming in, we don't have a significant kind of amount of budget to enable us to kind of take that on further. But yeah, we do have kind of people that kind of take that forward. But certainly one for us in the future. Now we've got potential for additional resource to invest in that.
There are no further hands, so we're recommended to note at 2.1, 2.2, but at 2.3 we're asked to approve the increased contract payments to service providers to enable the increased hourly wage payment. I'm assuming nobody disagrees with that. Also to instruct the Chief Finance Officers, Dave, to report on progress to the April 2022 IJB meeting. Do we have to put something in the recommendations about a direction to?
Yeah, thanks, Chair. That would be helpful.
To Dundee City Council.
Yeah, thanks, Chair.
Yep, if you could add that as well. I didn't actually realise we were almost at the end of the meeting, but we are. So next item, please.
Yeah, item 13 then before is winter plan, NHS, Teesside and partner organisations.
I think Lynn Mormon's actually going to speak to that one.
That'd be good.
Hello, yep, thank you. Just a very brief summary of the winter plan. As you know, NHS Teesside, in conjunction with the 3 Teesside partnerships, is asked by the Scottish Government to produce a winter plan every year. So this is our recommendation that the IJB approves the draft winter plan for this year. It will be presented to all 3 of the partnerships and also the NHS board. I just want to give you a few highlights from the report. As ever, our winter plan is governed by the Teesside Unscheduled Care Board, and the Unscheduled Care Board works very closely with the principles of the National Unscheduled Care Priorities. So for this year, we have grouped those around 4 key areas. One is optimising discharge, one is interface care, one is reshaping urgent care, and the other is the winter planning. So most of the national priorities are sitting within one of those key work streams. There is also, obviously, since the report was written, quite significant government funding that has come to try to support boards and partnerships to deal with what we think is coming over the next month in terms of the Omicron variant and the additional pressures that we're going to experience. So in addition to that, to the current work streams, we've also got some money that we have agreed that we will spend on a very collaborative basis on a Pan-T side. So I think we were speaking earlier about the lack of collaboration, but actually that's not our experience. So across NHS side, Perth and Kinross, Angus and Dundee, we now have a senior leadership group that will ensure that the budgetary alignment across the three partnerships is spent consistently in order to support early discharge from hospital and, as much as possible, trying to provide care and support for people in their own homes. So that's really what the actions around this work stream will focus on. The key principles of the winter plan are around prevent, inform, respond and communicate. So prevention is obviously around all of the measures that we've already discussed today around vaccination and trying to make sure that we protect both the public and staff. Inform is about our already well-established whole system escalation plan. So for the last 2 years, we have a whole system heat map that we report on a weekly basis across all three partnerships through the business unit and NHS side. And that helps us to track pressures in the system and to predict where, as a whole system, we will need to support pressures in other areas. So it really has informed good whole system collaborative working. And this year we've worked again to really strengthen and develop that escalation plan. The respond element of that is about our business continuity plan. And again, that's a very collaborative whole system approach across Tayside, and communication. So key across all ward areas, into partnerships and primary care and back through into secondary care again, and making sure that that communication is very tight. So they are the key principles within the plan, but obviously this is going to be one of our toughest winters, not just dealing with winter pressures, but also obviously dealing with the ongoing pandemic and the likelihood of the impact that will have on staff. So I think that's probably all I need to say. Thank you.
I'd almost forgotten about the annual winter planning money, given the fact that we seem to be in a kind of crisis all the time because of the pandemic. But Trudy's first, please.
Yeah, thank you for your paper, Lynn. It's actually quite good to see you face to face, even if it is online. And I know I've emailed you quite a lot, but I want to commend you and your staff on the incredible work you do with the delayed discharge work.
Thank you very much, Trudy. Great team, working very hard.
Is that some sort of art installation you have behind you, Lynn? I noticed that, I think it was Danny Chandler had the same thing yesterday.
I'm being told that it looks like a padded cell, which is probably more accurate than an art installation.
It looks like something that might be on exhibition at DCA. But anyway, that's neither here nor there. Helen, Bailey Wright is next, please.
Yeah, thank you. Can I say, first of all, I'm really grateful actually for page 425. It's Appendix 5, and it's useful websites. I've actually looked a couple of them up actually, so I think it's the first time I've had anything like this, so thanks very much for that. I have a couple of questions on Appendix 1. It's about the funding. Do you feel that the funding, bearing in mind it looks like we're going to have a severe winter this time as opposed to last winter, have you been given a decent enough budget, and do you think that will see us through the winter? And the other question is about GPs. Just wondering, with the increase in the business that they're having to cope with, and I know that some GPs have gone off and done other things, and there seems to be a shortage of them. I'm just wondering if it's due to stress of the business that's been heaped on them because they're not used to do some of these things that they've been asked to do. I'm not sure if you could answer that one, but
thank you. So the first point you made was about the funding, and I think the Teesside Unscheduled Care Board is, I think, a very good example of, again, collaborative working. And for the last probably 3 or 4 years, we have quite an unusual situation where much of the funding that comes from central government is delegated to the partnerships. So a real commitment from NHS Teesside into understanding that if we don't have good, robust community support services, the actual inpatient base can't be supported. So I think that's really unusual nationally and to be commended. And we have been identified by the government as an exemplar site in terms of our collaborative whole system working for the management of delayed discharge, but also trying to move away from delayed discharge and being far more about positive management of capacity and flow across the system and having positive solutions to that. So I think the money is, it's always a very positive and collaborative process that we have to discuss how that money is spent. And I would say that money isn't our issue this year. I see Jenny will want to come in here. The issue we will have is that we can't actually spend some of the money because of our staffing and recruitment issues. Yeah. So we have huge problems, but it's not about the amount of money that we have. And in relation to primary care, should say also that a lot of the community development work we're doing around building up an advanced nurse practitioner workforce, looking at what the nurse consultant role is, so having people working in a nursing role or an AHP role, but at the very top of their licence, in order to try to address some of the scarcity of GPs, as you noted, Bailey Wright, but to really support GP practice, primary care and secondary care by developing a different workforce. And much of the funding for that is coming through a primary care improvement plan. So again, a really good collaboration between primary care, the partnerships and secondary care. So I would hope that this year, one of our main focuses will be on developing that ANP workforce, which will support GP practices.
Jenny, would you like to come in here? Oh, sorry, Helmer, you want to add something?
no, I was just going to say to Lynn, it's good to hear that.
I was going to comment, my understanding is at the moment, through talking to Dr. Webber yesterday, that they're in the process of doing the sustainability survey with GP practices, and that will provide a more comprehensive overview of what the workforce issues are, and that will then feed into the workforce planning that we do as a partnership on an integrated basis. So it's probably a bit premature to comment on any particular issues around that at the moment. I think Lynn's covered the rest of it quite well, if that's okay.
Yeah, thanks for that, Jenny. I'm pleased to hear that as well, that the survey is going to be done, because I think sometimes the GPs are sort of lower down the list, and they're doing a fantastic job in their communities and keeping everything going. It's juggling. So I'm pleased to hear that. Thanks.
Oh, yeah, there's 3 Lyns here today, including me. So let's go to Lyn number 2, Councillor Short.
No, short one. Definitely. I like that you're currying favour with the GPs, Helen. It's a very good move, seeing as we've got one now. I hope you've enjoyed it, David. Actually, my question is probably a bit risky. There is very much a body politic who are into active travel, who are sort of very keen to see active travel routes gritted so that they can continue to go on their bikes and be healthy. But for me, I would rather see Fleming Gardens, for example, or Kersview Terrace gritted pavements, because surely winter planning must have a lot of slips and trips because of the nature of Dundee. And as older person's champion, I can't not ask, what kind of conversations actually happen between the Health and Social Care Partnership and basically Tayside contracts, who are our medium of actually delivering that service? Because I would imagine that that very small amount that you might pay to make it happen would take a huge weight off of the money that's spent within the NHS and the Health and Social Care Partnership if you have a trip and slip. Or maybe that's too simplistic.
Anyone care to comment?
Yeah, no, we do have those conversations, and we have been known to ask them to do additional bits and specific bits. So there very much are those links in to kind of have that discussion. You're right, though, cold weather snap is not what we need right now.
No, definitely not. No. So it is something that's there. Okay, thank you.
Yeah, well, that's good, because I broke my wrist a few years ago on the ice. Donald.
Thank you, Chair. I mean, I agree with what others have said. It's a really good plan. It's robust. It's well thought through. And I think the thing that I appreciated as well, because I was looking to see that lessons had been learned from last year, and it was good to see a section that actually calls that out, because, you know, we need to learn and develop and improve. So that's great. My question is a bit of a techie one. On page 15 of the plan, I got to the statement that Appendix 4 illustrates a snapshot of the unscheduled care dashboard, which I got quite excited about, because that's the sort of thing that interests me. So I was a wee bit disappointed when I went to Appendix 4 and it seemed to be something completely different entirely. So it maybe one to just outside of the meeting go and have a look and see whether appendixes have got a wee bit muddled in case this is getting sent further abroad, because I think, you know, dashboards are really useful tools. I would like to see more of them across the Health and Social Care Partnership generally, but I just didn't, that reference didn't look right to me. But no, well done, a really good document.
Thank you.
Thank you for that. I'm just trying to scroll back to the top of the page. Yeah, we're asked to note and also endorse the winter plan, which, as has been said, is really comprehensive. If you've missed anything out, I wouldn't be sure what it is. So well done. Can we approve this, please? No dissent. Thank you. Yeah, you can go, Lynn, because we're just one item now. Thank you.
Thanks very much.
Oh no, not you, Lynn. There's two Lyns. Yeah. Aye. Well, both of you can go. Yeah. Sorry. There's two laptops. Too confusing. Right. So I think it is now the final item, Willie. Is that right?
Just about, Chair. Item 14 is the agenda note and Dundee Integration Joint Board Budget Development, which you're asked to note.
Yep. Duly noted. Well, I'm looking forward to that.
Yeah, item 15, before you, with that item having been noted, is the attendance return. That's also for noting.
Yep. Okay.
And then lastly, the date of the next meeting is Wednesday, 23rd of February, 2022, 10 AM. It will be held remotely. Yep,
that's my birthday. So anyone wants to have a collection or whatever, because it's quite a big birthday. And I suppose that's it. I wonder if Vicky and Trudy could stay in the meeting just for a couple of minutes. Thank you.
Could I just make a point, Ken?
Yeah.
You never give us a break and a chance to walk about for 5 minutes. So
I'm sorry, it never occurred to me today, Helen. I should have done that. But if I do that in future, feel free to say.
Yes, I will do.
Yeah, sorry. I could have done something about it well, actually.
Yeah, Merry Christmas to everybody.
Thanks very much. Hope everyone has a good Christmas and gets a break.